How do we get rid of floaters? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. Floaters happen in one part of the eye, a part of the eye we call the vitreous humor. It fills the whole back of the eye. All sorts of things can happen there. So really the answer to the question about how to get rid of floaters is to treat the cause of the floaters. Just to take a couple examples. If someone has diabetes, then all of the blood vessels that deliver blood to the retina in the back of the eye, they can start to close. And if they start to close enough, then the retina in response will form all sorts of crappy blood vessels which start to bleed inside of the eye. And those, my friend, are floaters. And they can be so bad that they're even blinding. So that's one example that I'm talking about when I say we treat the cause. In that case, we treat the diabetic retinopathy, and we do so with eye injections, laser, surgery, etc. But if we just talk about the most common cause of floaters, what we're referring to really is changes in the vitreous due to time. And among those things is an event we call a posterior vitreous detachment, otherwise known as a PVD. When this happens, the gel, as influenced by time and also myopia or nearsightedness, the gel separates away from the retina. And when it does so, it causes floaters and flashes and so on. And if that ever happens, we have to dilate the eye because someone in that moment is at risk of a retinal tear. But assuming we don't find a retinal tear, then for most people, the floaters tend to lighten up to the point where they're there. They're kind of annoying. Maybe they show up every once in a while, but that tends to be the end of it for most people. However, there is a group of people out there who say, my floaters are there, they're horrible, I need them out of my eye. I can't drive, I can't work with them, etc. And so in that case, we have several options to take care of it. One option is a medication that dilates the eye. If you ever dilate your eye and you have floaters, you might notice the floaters are better. Unfortunately, that causes side effects, including making the vision fuzzy. And where I live in a sunny state of California, it's just not a viable way of going about it because there's so much sun. You go outside and you really can't see very well. So I don't really consider that a reasonable option. The next thing is a laser procedure called YAG vitreolysis. I'll spare you the details, but it's an exploding laser, and if it gets too close to vital structures like the optic nerve in a retina, it can explode right on the retina. It can harm the vision potentially. I just don't see it as really that safe. And in fact, when I've met people who have undergone this, assuming that they weren't hurt, by the way, I wouldn't say it's so common that it's like a dangerous thing, but nevertheless, when people have done it, and I've met them, they say, yeah, the floaters are a little bit better, but they're not totally gone. The final option is to do a surgical procedure called a vitrectomy. This is essentially removing the gel from the eye. It's done in the operating room. It's invasive, but it's also very effective. When I do this for people, they're very satisfied. Now, I usually suggest that someone not do it under certain circumstances, like if there's no PVD, for example, then it can be dangerous because I have to forcibly remove the gel from the eye. Or if someone hasn't undergone cataract surgery, the natural lens is still in the eye, then someone can get a cataract in response to all this. There's also a risk of retinal detachment, risk of infection, etc. So you really have to think it through before you start saying, let's go have a vitrectomy for floaters. And to me, the most important fundamental question in this whole conversation is, are you really bothered by it? Is it so bad that you feel like you need to go to the operating room? If so, I say we do it, making sure you understand the risks.